presentation was given at a policy forum titled Cannabis Use and Problem Gambling in Ontario Youth, co-hosted by GREO, Gambling Research Exchange Ontario, and the Ontario Centre of Excellence for Child and Youth Mental Health. Balodis presents Marijuana and Gambling Associations from Connecticut High School Survey Data. Dr. Balodis is an assistant professor at the Peter Boris Center for Addiction Research at McMaster University. Dr. Balodis' research targets understanding the motivational processes influencing the maladaptive decision-making that drives people suffering from addictions. Specifically, this entails examining arousal, emotion, and anticipation that direct behavior. This research approach cuts across traditional psychiatric boundaries and examines constructs such as impulsivity, thought to underlie many aspects of pathologic behavior. Dr. Balodis' research samples not only from substance-dependent populations, but also from individuals with gambling disorder, the first non-substance-based addiction, at-risk or adolescent populations, notorious for making poor or risky decisions, as well as individuals suffering from obesity. Taken together, this research program establishes how reward and stress system alterations relate to motivation and decision-making in addiction. Dr. Balodis integrates behavioral research with neuroimaging, psychophysiological, and clinical approaches across multiple conditions, with the goal of explaining and possibly modifying the mechanisms for change. This video has been narrated from a script developed by Dr. Balodis' presentation at the GREO Policy Forum on Cannabis Use and Problem Gambling in Ontario Youth on June 22, 2017. I'm going to present some work from Dr. Marc Potenza's lab at Yale University. Specifically, I'm going to focus on two different studies that were first in linking problem gambling severity with different measures of drug use. The first study, led by Andrea Weinberger, examines the link with smoking status, and the second one, by Chris Hammond, looked particularly at marijuana use and how that related to different problem gambling measures. To begin, we know that gambling is very common in adolescence. Over 80% of adolescents report some form of lifetime gambling, whether that be online, scratch tickets, bingo, or other activities like that. And we know a subset of these individuals experience problems with gambling. In the general adult population, we have rates of approximately 1 to 4% cited as experiencing problems with gambling. However, in younger populations, we often see profiles of individuals who don't necessarily meet the full criteria for gambling disorder, but that display certain symptoms or clusters of symptoms that are related to problem gambling. We call this group ARPG, at risk of problem gambling. And these rates are significantly higher, with over 20% in adolescent and young adult populations. The ARPG group is associated with poor social occupational functioning, and there is also a high degree of comorbidity, with conditions like depression and anxiety often co-occurring with ARPGs, and probably most common is a co-occurrence of other substance use disorders. Alcohol use in particular, and smoking is very high in ARPG groups. Illicit drug use, marijuana, and perhaps less expected, caffeine use is particularly high, as well as aggressive behaviors such as carrying a weapon or carrying a gun. Now, we also know that smoking is very common in adolescence. Over 50% of high school students endorse having tried smoking, and about 1 in 6 report that they currently smoke. And this is particularly important for us to understand in this population because most people who start smoking start during their adolescent years. It's quite rare to start when you're older. We know now that smoking is associated with many different psychiatric and medical conditions. And while the relationship between smoking and gambling is quite well characterized in adult populations, there have been very few studies to date looking at this relationship in adolescents. This is the first paper by Andrea Weinberger. It's one of the first adolescent studies to look at gambling behaviors and attitudes by smoking status and problem gambling severity, with a variety of health and well-being measures included into it. The high school survey was conducted in Connecticut at Yale University in Dr. Marc Potenza's lab. The survey was done with most of the high schools in Connecticut. Students filled out 154-item self-report surveys, which included a range of questions about gambling behaviors: types, locations, triggers, motivations, other substance use, and other types of health variables as well. They defined gambling as any game you bet on for money or anything else of value. Individuals were grouped by their gambling status, which was determined by 2 measures. 1, whether they reported gambling in the past year, and 2, their results from the Massachusetts Gambling Screen, or MAGS, which is related to the DSM-4 criteria on pathological gambling. If they reported one or more DSM-4 criteria, they were grouped as an ARPG. And if they endorsed gambling in the past year but didn't report any DSM-4 criteria, they were categorized as a low-risk gambling, or LRG, sample. Smoking status was also assessed through self-report measures, so whether a participant self-identified as a current smoker. Non-smokers were participants who responded that they never smoked or smoked once or twice in their lifetime. To be part of the smoking study, only those individuals who answered the gambling and smoking status questions were included, which generated a sample of approximately 1,500. I should also mention that for all these analyses, other variables such as gender, ethnicity, grades, and family structure were entered into the model as covariates so that these factors wouldn't have influences on the data. If we look at the ARPG group who smoke and compare them to the ARPG group who don't smoke, we see a variety of differences in gambling types and location. The ARPG who smoke report increased slot machine gambling, poker machine gambling, and less strategic gambling. There is less report of playing games of skill, which is actually significantly less endorsed by the LRG group as well, which we will look at in a moment. The ARPG group who smoke also report increased gambling online, in school, as well as in casinos, which is particularly interesting since most of these students are not of age to go to a casino and legally gamble. The casino gambling is also significantly more endorsed by the LRG group, as we'll see on the next slide. We see different types of triggers as well. The ARPG group who smoke reported feeling pressure to gamble and gambling to relieve anxiety. They report gambling with strangers or alone, which may relate to online gambling. They report increased time spent gambling and earlier gambling onset. This is an interaction effect with the low-risk gamblers as well. The ARPG group who smoke report increased use of scratch tickets and having received more lottery tickets as gifts. They also report perceived parental approval of gambling. Overall, they also endorse less items related to problem gambling prevention measures, for example, increased ID checking. Now, if we look at the LRG adolescents who smoke, we also see increased non-strategic gambling, more school gambling, and gambling to relieve anxiety. They endorse gambling more for financial reasons, but what's interesting here is that they endorse gambling with friends and alone. And this relationship with friends is more significant than it is with the ARPGs. The LRGs also report increased time spent gambling, earlier onset, increased scratch ticket play, and lottery tickets as gifts. They have decreased perceived parental disapproval, which came out in the data as well. And again, less endorsement of prevention measures for problem gambling. Overall, to summarize this large body of work, smoking appears to be associated with more severe gambling behaviors in adolescents, and we can potentially use this data to think of smoking as a clinical indicator of more severe or more problematic gambling in this adolescent group. A clinical indicator in this case would be a measure which suggests greater impairments or more severe gambling problems, a sort of red flag, so to speak, if you see these behaviors co-occurring. And this would be important to integrate into prevention and intervention efforts with adolescents who gamble. We additionally know that marijuana use is common in adolescents. These are statistics from Canada which show that approximately 43% of adolescents report lifetime use, which means they have used marijuana at least once in their lifetime, with 5% reporting weekly or daily use. And there are additional statistics from the Canadian Community Health Survey for the year 2012 in the age group of 15 to 17, showing rates of approximately 20% that reported for past year marijuana use, and in the age group of 18 to 24, already much higher at about 33%. Getting back to the Connecticut high school survey data, this was a study led by Chris Hammond looking at the relationship with adolescent marijuana use and problem gambling severity. And this time the sample was slightly larger, with just over 2,000 respondents who responded to both of these questions. People were categorized as lifetime marijuana users if they responded yes to the question, "Have you ever smoked marijuana?" If they responded yes, they were grouped as lifetime marijuana users. If they responded no, they were classified as a non-user. Problem gambling severity was again based on past year gambling, as well as endorsing at least one DSM-4 criteria for pathological gambling. There's also a non-gambling group included in these analyses that reported no lifetime gambling, that is, never having gambled in their life. And for this study, we again have a low-risk group, or LRG, and an at-risk group, or ARPG, as well. These are the results of this second study. 44% of respondents reported lifetime marijuana use in this sample, again meaning they have used marijuana at least once in their lifetime. So this is very similar to what we've seen reported in the Canadian adolescent population. And of this 44%, 63% reported using in the past 30 days. So if we break this down a little bit further, we can see that in the past 30 days, about a third of the sample report no regular marijuana use, but about a quarter report smoking daily. In terms of gambling groups, we can see the ARPG group constitutes approximately 28% of the overall sample. And not surprisingly, problem gambling severity is associated with marijuana use. There are more ARPG individuals in the marijuana-using group than in the non-using group. 35% of the ARPG group are represented in the marijuana-using group versus 22% of ARPGs represented in the non-using group. In terms of gambling behaviors and motivations, comparing the marijuana-using and non-using groups, we can again see differences in the marijuana-using group related to non-strategic and machine gambling and gambling locations. They report more gambling online, school gambling, and casino gambling. What's striking is the statistics showing that over 50% of the lifetime marijuana users report gambling at school. So if we are thinking about potential interventions or prevention efforts, over 50%, or approximately 52%, are reporting gambling at school. So that can have a significant impact for planning these interventions and prevention efforts. Gambling triggers are significantly higher in response to negative triggers, so urges, anxiety, gambling motivations, financial reasons, escape, or social reasons. Gambling partners were more likely to be reported as friends, strangers, or alone. And as before, we see increased gambling weekly. The minimum was 2 hours or more, so this means more than 2 hours weekly. And the age of onset is significantly younger in marijuana users. They tended to report beginning gambling younger than 9 years of age. Looking again at both marijuana using and non-using groups, and specifically at gambling behaviors contrasting the ARPG versus the LRG adolescents, we see more engagement in basically all forms of gambling, and gambling at all sorts of different locations, online, school, and casino. We see motivations that range from positive excitement seeking to financial reasons, reduction of dysphoria or escape motivations, gambling to reduce anxiety, gambling with a variety of different people, and overall just spending significantly more time gambling. If we relate this now to health functioning measures, we can see that in both the LRG and ARPG groups, we see significantly increased substance use reported both in terms of experimentation as well as regular use. One of the interesting things in this study is that the marijuana-using group reported greater impairments across many of these health functioning variables that I just mentioned. But at the same time, they found weaker associations with problem gambling severity. What this means is that some problem gambling-related impairments may potentially be attributable to marijuana use, so there's overlap in variability in health functioning measures between these two groups. Although these were some of the first studies to use a large sample to look at the relationships between problem gambling severity and smoking and marijuana, there are quite a few limitations we need to consider for these studies. For one, there is a lot of cross-sectional data, which represents just a sort of slice in time, and because of that, we can't really look at causal determination, so what came first or what's influencing what. Additionally, self-report measures have certain problems associated with them, especially when we're questioning about illegal activities or illegal situations, such as using drugs. They create the potential for responder bias. Responders may over-report out of bravado, for example, or they may under-report out of fear or shame. It's also not a nationally representative survey, as this survey was conducted only in the state of Connecticut. There's also non-response bias. I provided some of the sample sizes, but in fact, there were about 5,000 students in total that answered these surveys, and many of them didn't answer a lot of these questions, so they weren't included in the analyses, which could potentially bias the responses. They may not have responded because they do engage in these activities, that is, smoking and gambling, and they don't want to report it. So there could be a significant non-response bias with about 2,500 people of the 5,000 who are not included in these analyses. Certain measures were good, for example, being based on the Massachusetts Gambling Study, or the MAGS, which relates to DSM-4 criteria for pathological gambling. But many of the measures are not as precise, such as the never versus ever measure, which is a very rough measure of marijuana use, and doesn't capture, for example, the difference between someone who has tried marijuana once in their life versus someone who smokes daily. There's also an exclusion of certain special groups. For example, in the smoking study, there are people who report occasional smoking who were excluded from the analyses. But we know from smoking research that people that are occasional smokers have a very different profile. Also, in examining potential mediators, we didn't look at gender effects or features of impulsivity, for example, or other personality features that may cut across these different measures. I also want to highlight that these data are from the early 2000s. There have been significant changes in the gambling landscape, for example, with the advent of online gambling and then the legalization of online gambling. As the landscape is completely changing, people's attitudes towards it are changing as well. And it's a similar case with marijuana, as there is a different attitude towards marijuana now, especially with people knowing that it's going to be legalized. We also know from data coming out that the potency of marijuana has changed quite a bit in the past few decades, with extremely high potent THC coming out, as well as different compounds. That makes it very difficult to compare with data and research from several decades ago. Additionally, as mentioned earlier, longitudinal research is a very important future direction because cross-sectional research just provides this little slice in time and doesn't effectively show us the long-term effects in the same individuals. Finally, a particular area of interest is how marijuana use modifies gambling behaviors. One of my main research interests is in understanding motivational neurocircuitry. One of the things that we know is that this neurocircuitry in the brain, including the prefrontal cortex and areas of the thalamus striatum, are all developing during adolescence. And we also know that a lot of the impulsive behaviors, sensation-seeking behaviors, and drug experimentation that we see during adolescence is related to the fact that these circuits are developing, changing, and maturing. At the same time, we have very little information on what regular use of marijuana, whether it's daily or weekly, does to a developmental neurocircuitry or to a motivational neurocircuitry that is developing at this time. There are many different clinical implications, and a few are highlighted here. One thing we've seen come up in these data, as well as in some other studies, is the idea of parental permissiveness and approval, or it's perhaps just perceived parental permissiveness and approval. It's reported in different ways by students and adolescents, so that could be a potential area of future research. Another important implication is for efforts to increase screening for gambling and substance use, and in this case we mean screening for these together because often in different treatment settings or clinics, healthcare professionals will ask about one or the other, but as we saw with the marijuana and smoking data, these activities tend to go together and they tend to be red flags or clinical indicators of potentially bigger problems. There are also implications in terms of taking an integrated approach in systems of care, where again different people are asking specific things but not bringing them all together into one approach. And one of the obvious implications is regarding strategies such as limiting gambling availability, whether it's access to online gambling or to venues like casinos, because we do see casino gambling particularly endorsed in adolescents who are not of age. I'd like to thank Dr. Marc Potenza and all the different people involved in this work. In particular, Dr. Corey Pilver and Dr. Ronnie Hoff, who did most of the analyses, and also my colleagues at the Peter Boris Center, Dr. James McKillop and Dr. Michael Amlung. Thank you. Thank you for watching this presentation, Marijuana and Gambling Associations from Connecticut High School Survey Data, by Dr. Iris Balodis, which was part of the GREO Policy Forum on Cannabis Use and Problem Gambling in Ontario Youth on June 22, 2017.